I bet you didn't know how the heart's rhythm keeps you alive every second. The human heart, a tireless muscle, beats rhythmically throughout our lives, propelling life-sustaining blood to every corner of our bodies. Each heartbeat is a carefully orchestrated sequence of events, ensuring efficient blood flow and oxygen delivery. The cardiac cycle encompasses the period from the beginning of one heartbeat to the beginning of the next. The heart's efficiency in performing this task is a testament to the elegance of the cardiac cycle. The sinoatrial or SA node, often referred to as the heart's natural pacemaker, is a small cluster of specialized cells located in the wall of the right atrium. This tiny but crucial component of the heart is responsible for initiating the electrical impulses that dictate the rhythm of your heartbeat. These cells possess the unique ability to spontaneously generate electrical impulses, setting the rhythm for the entire cardiac cycle. This spontaneous activity is what makes the SA node so vital. Without it, the heart would not be able to maintain a consistent rhythm. The SA node initiates each heartbeat by sending an electrical signal that spreads rapidly through the atria. This rapid transmission ensures that the atria contract in a coordinated manner, effectively pushing blood into the ventricles. This signal triggers the contraction of the atria, pushing blood into the ventricles. The precise timing of these contractions is crucial for efficient blood flow and overall cardiovascular health. The SA node's inherent rhythmicity is essential for maintaining a regular heartbeat. This rhythmicity is what allows the heart to function as a reliable pump, delivering oxygen-rich blood to the body. The electrical impulses generated by the SA node are not random. They occur at a regular frequency, typically between 60 and 100 times per minute in a healthy adult at rest. This regularity is what keeps the heart beating in a steady, predictable manner. The SA node's role as the primary pacemaker is due to its faster intrinsic firing rate compared to other potential pacemakers within the heart. This dominant role ensures that the heart maintains a consistent and efficient rhythm, which is essential for sustaining life. Atrial systole marks the beginning of the cardiac cycle, initiating the sequence of events that lead to ventricular contraction and blood ejection. During atrial systole, the atria contract, increasing the pressure within their chambers. This pressure gradient forces blood to flow from the atria into the ventricles, topping off the ventricular volume. The atrioventricular valves, the tricuspid valve on the right and the mitral valve on the left, are open during this phase, allowing for unimpeded blood flow. Atrial systole contributes significantly to ventricular filling, ensuring that the ventricles are adequately primed for their subsequent contraction. Ventricular systole is the phase of the cardiac cycle where the ventricles contract, generating the pressure required to propel blood into the pulmonary and systemic circulations. This is a crucial moment in the heart's function, as it ensures that oxygen-rich blood reaches every part of the body, while deoxygenated blood is sent to the lungs for oxygenation. This phase is characterized by a dramatic increase in ventricular pressure, exceeding the pressure in the atria and forcing the atrioventricular valves to close. This closure is essential to maintain the unidirectional flow of blood, ensuring that it moves forward into the arteries rather than back into the atria. The closure of these valves prevents backflow of blood into the atria. This mechanism is vital for the efficiency of the heart's pumping action, as it ensures that each contraction effectively pushes blood into the circulatory system. Ventricular systole is the heart's power stroke, driving blood out of the heart and into the arteries. This powerful contraction is what keeps blood circulating throughout the body, delivering essential nutrients and oxygen to tissues and organs. Ventricular systole can be further divided into two main phases: isovolumetric contraction and ventricular ejection. Each phase plays a critical role in the overall function of the heart, ensuring that blood is efficiently pumped out of the ventricles. During isovolumetric contraction, the ventricles contract, but the volume of blood within them remains constant because all valves are closed. This phase builds up the pressure necessary for the subsequent ejection of blood, setting the stage for the heart's powerful pumping action. Section 5. Isovolumetric contraction. A moment of silence. Isovolumetric contraction is a brief but crucial phase of ventricular systole, occurring immediately after the atrioventricular valves close and before the semilunar valves open. During this period, the ventricles are contracting, but the volume of blood within them remains constant. This is because all four heart valves, the tricuspid, mitral, pulmonary, and aortic valves, are closed. The term isovolumetric literally means same volume, reflecting this constant blood volume within the ventricles during this phase. Although the volume of blood within the ventricles remains constant during isovolumetric contraction, the pressure within the ventricles rises rapidly. Section 6. Ventricular ejection. Blood on the move. Ventricular ejection is the culmination of ventricular systole, the phase where blood is forcefully expelled from the ventricles into the great arteries. This phase begins when the pressure within the ventricles exceeds the pressure in the aorta and pulmonary artery, forcing open the semilunar valves. The opening of these valves marks the beginning of blood flow from the heart into the systemic and pulmonary circulations. The force of ventricular contraction propels oxygenated blood into the aorta and deoxygenated blood into the pulmonary artery. The ejection phase can be further divided into two subphases: maximum ejection and reduced ejection. Section 7. Ventricular diastole, the relaxation phase. Ventricular diastole is the period of ventricular relaxation, allowing the heart to refill with blood in preparation for the next contraction. This phase begins with the closing of the semilunar valves, preventing backflow of blood from the aorta and pulmonary artery into the ventricles. Ventricular diastole is a period of relatively low pressure within the ventricles, allowing blood to flow from the atria into the ventricles. This refilling process is essential for maintaining adequate ventricular volume for the next heartbeat. Ventricular diastole can be further divided into several subphases: protodiastole, isovolumetric relaxation, rapid filling, and diastasis. Section 8. Heart sounds, the symphony of the heart. Heart sounds, often described as loop-dub, are the audible manifestations of the mechanical events of the cardiac cycle. These rhythmic sounds are not just random noises, but are crucial indicators of the heart's health and functionality. These sounds are produced by the closing of the heart valves and the turbulent flow of blood within the heart chambers. The precise timing and quality of these sounds can reveal a lot about the state of the heart and its efficiency in pumping blood. Auscultation, the process of listening to the heart sounds with a stethoscope, provides valuable information about the heart's function and can help identify potential abnormalities. This technique is a fundamental skill in medical practice, allowing doctors to detect issues such as valve malfunctions or heart murmurs. The first heart sound, S1, or the elub, is produced by the closure of the atrioventricular valves, the mitral and tricuspid valves. This sound is a critical marker in the cardiac cycle, indicating the onset of ventricular contraction. This sound marks the beginning of ventricular systole, the period of ventricular contraction. During this phase, the ventricles contract to pump blood out of the heart and into the arteries, ensuring that oxygen-rich blood reaches all parts of the body. Section 9. Mechanical events, pressure, volume, and movement. The mechanical events of the cardiac cycle involve the coordinated changes in pressure and volume within the heart chambers, driving the movement of blood through the heart and into the circulation. These events are intricately linked to the electrical activity of the heart, ensuring efficient and unidirectional blood flow. During atrial systole, the contraction of the atria increases atrial pressure, pushing blood into the ventricles. Ventricular volume increases as the ventricles fill with blood. Ventricular systole then follows, with the contraction of the ventricles leading to a dramatic increase in ventricular pressure. Section 10. The importance of understanding the cardiac cycle. Understanding the cardiac cycle is fundamental to comprehending the heart's function and the complexities of cardiovascular physiology. This knowledge provides a foundation for diagnosing and treating various heart conditions. Appreciating the intricate interplay of electrical and mechanical events during each heartbeat is crucial for healthcare professionals and researchers alike. The cardiac cycle's efficiency is essential for maintaining adequate blood flow and oxygen delivery to the body's tissues. Disruptions in the cardiac cycle can lead to various cardiovascular diseases, such as heart failure, arrhythmias, and valve disorders.